If you've had a total knee replacement and your knee feels tight, like there's a tight band around it, even months or even over a year after surgery, I want you to know that you're not alone. That's a very common sensation that people experience after a total knee replacement surgery, and most of the time it's not due to a serious problem with your surgery. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what causes that tight band sensation, along with some tips that you can use to decrease your knee tightness. Now, first of all, what causes that tight band sensation around your knee? Well, there are a lot of different factors that contribute to it, but I'll break it down into 4 different subgroupings. One of them is vascular, one of them is capsular, one of them is muscular, and then one of them is neurological. Now, to understand this, you have to first kind of understand the state of your knee before you had the total knee replacement surgery. When you have knee arthritis, particularly if you've had knee arthritis for a long time, or if the grade has gotten really severe to the point where you need a total knee replacement, you've likely lost a lot of space between the 2 bones in your leg. Now there's a capsule that sits around your knee joint, and when you lose space inside that capsule, over time that capsule can kind of shrink up or stiffen up. Now additionally, they've found in people who have knee arthritis, as compared to people who don't have knee arthritis, that there's a lesser density of lymphatic vessels inside that synovial capsule. And lymphatic vessels are what help absorb swelling and get it back into your bloodstream. Now fast forward to the total knee replacement surgery, and you're going inside that capsule, you're cutting off bones, you're driving metal spikes into it, all of which creates a significant amount of bleeding and swelling. Then you close the capsule back up, and now you've got more stuff inside because you've just replace the cartilage that had worn down, and additionally you still have all of the swelling from the surgical procedure itself. And that takes that capsule that's still the same volume and it fills it with more stuff. So it makes it feel more tight and stiff. And additionally, because you still don't have a great lymphatic density, it's a lot harder to reabsorb that swelling. And lots of people will have persistent swelling for months or even years after a total knee replacement, and it may never go back down to the size of the other one. And that's okay. That's not a problem indicating that there's a issue with your surgery or that something's wrong inside the knee. That's just kind of the nature of the beast. But there are some things that you can do to decrease that stiffness. And one of the really important things to do right after surgery is just getting your knee moving as quickly as possible. If you're watching this either considering having a knee replacement or you've recently had a knee replacement, it's important to do your therapy right away before that capsule has a chance to scar down. You want to stretch out the capsule, which had become stiff before you had the surgery in the first place. And additionally, the bleeding and swelling inside that capsule, it can actually form scar tissue. So the quicker you get moving after the knee replacement, the less likely it is to feel stiff afterwards. But even if you do everything right with your rehab, some people do still experience a sensation of stiffness or tightness around their knee, again for months or even over a year after the surgery. And there are some other factors that play into that as well. We mentioned the vascular and the capsular components already, but you've also got some muscles around your knee. Now, when they do a total joint replacement, they replace the joint surfaces, but they don't replace the muscles, which have likely become stiff even before you had the procedure. There's actually a study where they did trigger point dry needling on people who were going to be having a knee replacement while they were under anesthesia, and they found that that dry needling group actually did better because they released the trigger points right before surgery. And because they were asleep, the patients didn't know whether they had it or not, so it wasn't due to placebo. Now, after the knee surgery, you may still have persistent trigger points in your muscles. And the ones that are particularly problematic for the knee are the calves, the hamstring muscles, and particularly a little muscle that goes around the back of your knee in what's called the popliteal fossa, and that muscle is actually called the popliteus. Now, newer studies have identified that popliteus problems, impingement of the popliteus inside the joint, can actually be a cause of persistent knee pain after a knee replacement surgery. Now, that popliteus, its function before you have a knee replacement is to unlock the knee when you go from a fully extended position to starting to bend it. So it rotates your tibia or your lower leg bone inwards, which helps unlock the knee. Now, that function isn't quite as vital once you've replaced the joint surfaces because they build that biomechanic into the knee where you don't need to have that internal and external rotation and end-range extension. Now, additionally, that popliteus tendon can sometimes get nicked or irritated in the actual procedure or stuck inside the joint. But even in the best case scenario, that popliteus muscle is still kind of trying to figure out its new role or its new function because it's not doing what it was designed to do in a natural knee. Now, when you're rehabbing your knee, it's also important to consider that rotational component of your tibia. Not right away, not right after surgery, because you still want to give that implant good time to settle in before you start twisting and torquing on the knee. But if you're several months after knee replacement surgery, there are going to be times when you're going to have to pivot and twist. And so making sure that you do restore that rotational mobility of your knee is important. Your physical therapist can help you do that with some manual therapy techniques. You can also do a technique at home where you cross your leg over and you kind of just pull and push. So you push with this hand, you pull with this one, and it's just a very slight glide. These are millimeters of motion. It's not like you're moving your knee a lot, but you're just restoring that normal rotational mobility of your knee into internal rotation. The last component that can give you a feeling of stiffness, tightness, or a band around your knee. That's the nerves that are around your knee. The sciatic nerve runs down the back of your knee, and then it splits into a tibial branch and a fibular branch right behind the knee. And then those further branch into what are called genicular nerves, which supply the actual knee joint itself. Now, those can get nicked or irritated during the surgery, and sometimes patients will even complain that they have a little bit of a numbness on their knee. And sometimes that doesn't go away. But in any case, you've moved things around, gotten those nerves a little bit hypersensitive and a little hyperirritable, and so they're still trying to figure out what the new normal is with the knee. So those were the 4 causes of that tightness or band-like sensation around the knee. And again, that was vascular, specifically your lymphatic vessels, the capsule being stiff or full, the muscles around the knee, and then altered perception from your nerves. Now I want to show you some other tips and specifically some devices that you can use to help improve that sensation of tightness around your knee. Now, one of the things that I've found that works great clinically is doing instrument-assisted soft tissue mobilization. And that can be any type of instrument. Most commonly, it's Graston tools, metal tools, or ASTIM tools, plastic tools that clinicians use in physical therapy around your knee or on your muscles. But this has been used for thousands of years, and gua sha tools, originally made out of stones, have been used back since ancient Chinese times. And essentially, you take something with sort of a sharpish edge, not sharp enough to cut you, and you just run it along your skin. People will often describe this as scraping, but you don't want to really be scraping hard to the point where you see bruises on your leg. And there are people who will go to physical therapy and get this treatment from well-meaning clinicians and come back just incredibly bruised. But the point of this is not to mechanically break things up so much as to stimulate a healing response. The edge of this catches on little adhesions in your muscles or even specifically in the capsule around the knee. And so it's good to use it around your knee cap, kind of over the ligaments around the knee, and on the patellar tendon, on the calf muscles, on the thigh muscles. Using this on all different areas of the knee can be helpful to help restore more of that tissue mobility. What this does is it actually kind of breaks up small neovascularization or little non-functional capillaries. And that releases a signal to your cells to restart a healing process. So it sends macrophages, cells that eat up old dead tissue, as well as it lays down new blood vessels, new functional blood vessels that bring fibroblasts, things that lay down new, more normalized tissues. And then by moving your knee appropriately, doing your physical therapy exercises, or using an exercise bike, that can help stimulate those new fibroblasts to lay down tissue more normally. And you can get these on Amazon. I'll put links below to all the products I mentioned here that you can find for relatively inexpensive. But again, these are just gua sha tools, and you run them along the knee, along the muscles, and around the joint. One word of concern, just make sure that your scar is well healed. You don't want to use this over a fresh scar that hasn't closed up well. Now, I did mention exercise biking can help with the remodeling process. And that's another thing that can be really helpful, is using an exercise bike. Whether you use it at physical therapy or go to a gym or have one in your home, using an exercise bike is really helpful. One, just to mechanically move the knee, move fluid around inside the joint capsule, help to stimulate remodeling of the joint capsule, and it increases blood flow and circulation, which will help flush some of that swelling out of the area. So using an exercise bike is another really helpful thing if you've recently had a knee replacement and it feels stiff or tight. Now, another thing you can use is a TENS unit. And while this doesn't mechanically do anything, it can help neurologically just with that sensation of tightness. When you use a TENS unit, it makes a tingly or vibration sense, and your brain picks up on that tingling or vibration, and it kind of ignores other sensations that may travel along slower nerve fibers. Additionally, depending on the settings that you use the TENS unit, if you use it on a setting where you can create sort of a rhythmic muscle contraction, that helps with kind of like a lymphatic pump, pumping fluid away from the knees, which you also get with exercise, but you can use this at rest to kind of further assist with moving fluid around the knee if you use the settings. And I've got another video that describes a little bit more in depth on how to use a TENS unit. And then finally, you can use a massage gun. This is the X6 Pro from Bob and Brad, but whatever massage gun you use, just kind of using it on the muscles, on the thigh muscles around the knee, on your quadriceps, on your hamstrings in the back of the knee, or on the calf muscles in the lower leg can be helpful. Now, I wouldn't recommend using a massage gun right in the back of the knee over the popliteus, because your sciatic nerve sits right back there and you really don't want to irritate that area with a massage gun. But just digging your fingers in gently and massaging the back part of your knee can also help out with that stiffness or tightness sensation. Now, one last tool that you can use if you have tightness around your knee after a knee replacement is a cognitive technique known as reframing. And that's essentially just altering the way that you think about it. If you think about it as a problem, something that needs to be addressed, why is this happening to me? What's wrong? Is something gone wrong with my surgery? Then your brain's going to pay a lot of attention to it. It's going to see it as a potential danger. And the International Association on the Study of Pain describes pain as an unpleasant sensory and emotional experience related to actual or potential tissue damage, or described in terms of such damage. So whether the tightness actually hurts or whether it's just bothersome, if you see it as something annoying or unpleasant and you're worried that it may indicate a problem, your brain's going to pay a lot of attention to it, and it's going to tell your nerves to send it lots of information about that problem so they can keep an eye on it and make sure it doesn't get worse. But if you think about this as just a normal experience that people have, that it doesn't mean that there was an issue with your surgery that needs to be addressed, and that you do have some tools that I previously mentioned that can help to decrease that tightness. It gives you more power over the situation, and it makes your brain worry about it less. And if your brain's not worried about it, it's not going to ask your nerves to send as much information. It'll say, don't tell me about that. I'm not that worried. I've got more important things to worry about. And you can go on with your life, and your brain won't keep focusing in on that tight sensation around your knee. So hopefully this video did give you some peace of mind to help understand that if you have tightness around your knee, there's probably nothing structurally wrong, and gave you some tools that you can use to help decrease that tightness. If it did, make sure to give this video a like, and if you haven't already, subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.